Doug, I guess I'm curious to know what advice you would have for patients, maybe at the outset. It's maybe a little different case. Let's say they get a diagnosis, a specific diagnosis, so at the same time.
Well, one of the things you want to do is realize that you're sort of going to need some kind of medical home if you have a chronic illness. So sometimes it doesn't necessarily matter which doctor it's going to be, but you're going to look for, whether it's a primary care or a specialist, somebody that you think that listens to you, that you can turn to, that you can. There's a lot of guidance on who can do what, and having a doctor who's sort of pre-decided, this is my patient. Sometimes I go out on a limb, whether it's a non-traditional dose or whether it's ordering a blood test when usually we wait 6 months, or so finding someone who's going to take ownership and partner with you is the first step. And you can be creative about that. Like, you don't have to just go, I have my hematologist is the quarterback. You can have a primary care be the quarterback. So a lot of times that's one of the first things. And the next is to figure out what level of confidence this diagnosis is. I can't watch the show House. I think the guy's a jerk. But apparently he walks into the room sure about everything, and for 46 minutes he's wrong every week. And so it's this. So as scientists, we don't have an immense surety to start with. So in the course of one day in the hospital, I had I got one test. It's very quick. I had one test for adrenal insufficiency. The first doctor came in and said, you have adrenal insufficiency. Your numbers were low. And 4 hours later, the next doctor came in and said, well, your level was low, but your increase was fine. You're probably fine. And the third doctor came in and said, good news. You're fine, your adrenals. That's one day. Now, I knew that was probably the resident and the fellow and the attending, but someone else, they would have thought all day. They would have been reading and freaking out about what their future looks like. So it's important to understand the difference between someone saying a diagnosis and something that holds up over time.
And just to go a little bit further, and I'm sure you ran into this, but how would you sort of advise a patient who's trying to advocate for themselves or maybe come up with their own suggestions, and they're running into just no from their doctors, or no, I'm the doctor here, you're the patient, like this is what we're going to do. How do you kind of collaborate there?
The advice that I would give a patient is actually the same thing I give a doctor, and that is to divide observation from explanation. Patients are bad at giving explanations because they're not clinicians or scientists. But that doesn't mean the observation you've come up with isn't very accurate. It could be rock solid, and your explanation for why is not overly sophisticated. So what you do is be clear. Here is what I have observed. And then you can say, I don't know if it's this. It's always better to ask it as a question. Might it be this? Than to tell the doctor what it is. But remember this, observation and explanation are very different. And all sorts of people can have very astute observations about their own health and not be able to explain them. Being able to separate those as you present them to a doctor will stop you from getting rejected, right away as putting forward, folk remedies or something else. So that's very important. Here's what I'm seeing. And then you can say, is it this?